Welcome to the Holistic Psychiatrist Podcast, a place for inspiration, insight, and information on holistic mental health. Join your host, Dr. Alice Lee, and discover critical information on safe, effective psychiatric medication withdrawal. Explore new ideas that enlighten and expand the mind with cutting-edge authors and experts, along with former patients as they share their miraculous healing journeys. It's time to build your well-being from the thought up. It's time for the Holistic Psychiatrist Podcast. Here's your host, Dr. Alice Lee.
Hello and welcome to the Holistic Psychiatrist Podcast, where we create well-being from the thought up. I'm your host, Dr. Alice Lee, the Holistic Psychiatrist, practicing now in Stamford, Connecticut. For more information about me and access to free articles, podcasts, and contact information, please check out my website, holisticspsychiatrist.com. Thank you so much for listening today. Today we're going to be talking about the long-term effects of SSRI use and the underlying causes for protracted withdrawal. So today it's very special because I'm going to be starting to collaborate on my podcast with my dear prior patient, Emily. She has agreed to collaborate with me on these podcasts and add an extra special dimension to our discussion. So I'm going to let Emily introduce herself and tell us a little bit about herself. I'm really glad that she was willing to collaborate with me on this podcast. So Emily, would you let the audience know a little bit about you?
Sure. Hi. Thank you for inviting me to do this. I'm really excited to do it. But yeah, like you mentioned, former patient of yours. So I have a little bit of experience with what it's like to go through psych med withdrawal. It was quite the experience and it has really shaped who I've become as a person today. Aside from that, I'm a photographer. So I have a home studio. I'm a boudoir photographer. And I'm actually working on a documentary film as well about medication withdrawal. So that's where something that was so horrific eventually led me to do something that I hope is very positive and powerful. So,
yes, wonderful. So yeah, Emily is ready and open to talk about what she had gone through and all that she's learned along the way about her experience with being on medications. And also she's going to be able to provide a patient's perspective on not only her experience with medication, her experience with withdrawal, but also so much knowledge about the healing process. So I'm really excited for us to be able to have a conversation and be able to talk about, any topic that has to do with holistic psychiatry. So today's topic, though, is what is protracted withdrawal and what are the long-term effects of SSRI use? This is really important. This is something that I've really come to an even better understanding within the last, I would say, 6 months. And I've been helping people with medication withdrawal for since 2002 using more holistic approaches. So over the last, 23 years, I've been learning layer upon layer about how to help my patients with withdrawal. Now today, we're going to focus on SSRIs because it will kind of serve as a springboard for understanding how serotonin reuptake inhibitors may have prolonged effects on people who use them and why some people have them and maybe why other people may not have protracted withdrawal. But Emily, you mentioned that when I suggested this topic, you had an immediate gut reaction to it, right?
I did, yeah, because it took a long time, and I think as it does for a lot of people to figure out what's going on with them and as far as withdrawal is concerned in general. And I started my research when I finally realized this was potentially withdrawal in the Facebook groups and different forums and reading the stories about protracted withdrawal really terrified me. Really, it just seems withdrawal is hard. What I told you was my reaction when I read it was, I remember very vividly thinking, this is already hard enough. I can't imagine going through protracted withdrawal. It was absolutely terrifying. Yeah.
Yeah. Protracted withdrawal, if we wanted to define it succinctly, is just withdrawal that just doesn't stop. People experience debilitating effects, and each person may experience different debilitating effects that last sometimes for years, and they just can't treat it with maybe what they learn about supplements. So, as a psychiatrist, I feel that protracted withdrawal is just this mysterious area in terms of withdrawal that we are not, properly protecting the patient from or preparing their body for, and therefore it lasts a long time. But what I've come to understand in the last 6 months is that, protracted withdrawal are those things that may have been going on for a long time, even before the person started medication, and may not be treated or may not be able to be treated with functional medicine approaches, such as nutritional supplements or glandular support or even hormonal support. So protracted withdrawal may last a long time because it requires a very special kind of intervention. And that kind of intervention is energy medicine. So we'll be talking a little bit more about what that means and what I've had to do to intervene in patients who I've tried to support with functional medicine approaches, but there's this gap between what functional medicine can do and all of the rest of the withdrawal symptoms that can happen. So one of the questions that I guess I'd like to start answering is why some people experience protracted withdrawal and others don't. And I think one of the key things that I've come to understand is that people have a lot of different underlying chronic health issues that result in the initial mental health problem, whether it's anxiety or depression. And once they start taking a medication like an SSRI that manipulates the neurotransmitter system and makes them feel like they're doing better, it doesn't necessarily heal the underlying issues. So depending on what those underlying issues are, some of them can heal fairly quickly within let's say a 3-month period as you're supporting the body with functional interventions like supplements or proper diet. But some people have underlying issues that don't get treated through a supplement. Or they may have been harmed by the medication to an extent where it's created a problem that won't fix itself with a supplement. So that's when some patients may lower the medications pretty well for the first 3 months after they stop. But after 3 months of coming off medication, they may have withdrawal. It's not so much withdrawal symptoms anymore because we call it protracted withdrawal, but it's not so much that the medication is gone. It may be because of the harm done by the medication, or it might be because the underlying causes have been going on for 20 years and, needs to be addressed and wasn't addressed completely. Yeah.
So I have a question about that. And I don't think we've touched on this previously, but that makes sense. And what I wonder is what happens to the people who don't realize that it's protracted withdrawal and then they're going back to their prescribing doctor? Because even I remember when I started experiencing symptoms, they're like, oh, you're getting better. Let's start coming down on the medication. Now what I realized were withdrawal symptoms setting in. They would tell me it was my, how was it phrased? I guess my initial symptoms, why I went on the medications in the first place. So now we go back up. So it was like this up and down that never really seemed to stop. Whereas I guess there is some truth to that in what you're saying, right? Because those initial kind of underlying symptoms that were never addressed are resurfacing. But I feel like that could be a trap for a lot of people.
Yeah, I mean, the quickest way to stop protracted withdrawal is to just get back on a higher dose of medication. And I guess the question then many people have is, why not just stop it with the medication? And one of the reasons I can come up with is that these medications do cause harm to the body and make changes in the body. I'm just discovering all of the long-term effects of these medications. So if you go back on the medications, you're kind of going back again and cycling back into this cycle of damage caused by the medication and changes as your body makes room for the medication again. So one of the things that I've discovered is called downregulation. And it's been around, so there's this term for it. But what I've discovered with my ability to use energy testing is how severe downregulation really means in terms of symptoms. So, for example, I had a patient who was on Lexapro for many years, and Lexapro is a very powerful SSRI, and she'd been on it and then off of it, and then she came back on it, and then she wanted to, get everything, all the ducks lined up in a row before she worked with me, and so we, put her on all these supplements, and she had a pretty easy withdrawal process coming off Lexapro. And at about 3 months after she got off Lexapro, when we thought the whole problem was done, like her withdrawal was done, is when she started to wilt like a plant that was just like, boom, like what was going on. So I had to dig deeper with my energy testing. And what I found alarmingly was that her genes that made the enzymes that created serotonin were down to like 20% of her optimal. And so her genes were no longer creating the enzymes to help her create serotonin. So if you don't have the enzymes to create serotonin, it's not a matter of me giving the patient more 5-HTP and pyridoxal 5-phosphate to help her to give her the raw materials to make serotonin. There's just no workers in her body to make that serotonin. And for a while, her serotonin levels were probably like kind of gradually coming down. And so we were very gradually lowering her Lexapro. And at some point, the storage levels were probably being depleted as well. So at that point, if you don't have the genes and you don't have the enzymes, you can't build serotonin to the optimal levels that you need. And that's downregulation. That's a long-term effect of how the body makes room for the Lexapro. So what the body does is it says, I have Lexapro, it's working like my serotonin neurotransmitter, so I'm going to just close down my factories and fire the workers and just let Lexapro do the work for me. Because I don't have to make serotonin, and I don't need the genes to make the enzymes to make serotonin. And if your body decides to do that, then, once you come off the Lexapro, to my surprise, it wasn't just downregulation by 5% or 10%. It was 80%. So how do you start the genes to, wake them up and make sure that they make serotonin when you can't give them anything functionally to make enough serotonin? So we started intervening with energy medicine. And energy medicine, the way we do it, is working with energy, using our mind to shift energy, just like maybe somebody who works with Reiki would shift energy. And we would use intentions to direct that energy to help with, activating the genes. I didn't at the time want to put the patient back on Lexapro because I thought, well, maybe if we can do this quickly enough, she can start making enough serotonin. What I also did to help was I gave the patient a homeopathic called serotonin, and it had the energy of serotonin. It didn't have the substance of a serotonin, but just the energy signature of serotonin. I also realized that as an energy healer, I could raise her numbers up by about 5 points every time I did energy work. But she had 80 points to go, and by then she was already suffering. So I asked another lady who could see people's energy fields and also do a lot of healing energy work to work together with me for the patient. And we did it every day for free. So this patient was scheduled and paid for once a week session, but she was in a situation where I felt like energy medicine was the only thing that really would work. So both of us were doing it for free, like the other, 6 days out of the week. And we would just do an hour of energy work each day, and saw her starting to improve in that way. Even so, it took so long in that respect that we did add, based upon energy testing, we added 3 milligrams of Lexapro. So she's on 3 milligrams of Lexapro, and I think before she started with 20. So she's on 3 milligrams, and she is healing now with all the energy work. Now we're doing 3 times a week instead of every day. But for that individual, because of where she was at and because of her poor GI functioning, we had to do it for about 7 weeks of daily energy work, free. So
that's 7 weeks of daily before you were able to move down to 3 days a week or so. Wow.
Yeah. I thought it would only take 1 week because there was another patient before her who was on 60 milligrams of Prozac. And he had a very similar kind of withdrawal problem where at about 3 months after he came off the Prozac, and he also had a very easy withdrawal process coming off the Prozac, but at about 3 months after, he also had protracted withdrawal. And we were doing as much as we can with functional support and some energy work. But at one point, it was clear that there was something going on that required more than just what we were doing. So for him, and he was the first person that acknowledged that there was something deeper that was going on with protracted withdrawal. So we, again, with this other lady, did energy work for him for free every day. But for him, it was for 1 week, and he completely felt like 100% better. He had very severe OCD symptoms, and after 1 week, he said his OCD symptoms, about 97% was gone.
Oh, wow.
So, yeah. So the protracted withdrawal had something to do with the recurrence of the OCD symptoms.
Mm-hmm.
So, as I was working very feverishly with energy work to help to undo things that cannot be undone with functional medicine for protracted withdrawal, I started learning so much about protracted withdrawal. And so I started intervening with patients who are in the process of withdrawing from their medications to help them in those areas that I was discovering was requiring additional energy work to help these patients with protracted withdrawal. So let's say if it was genes and enzymes, I started working more with my patients in the middle of their withdrawal process with genes and enzymes. Or if I discovered that SSRIs had a profound effect on the hypothalamus, I would work on their hypothalamus with energy work. And the patients who had that help earlier on in their medication withdrawal process were able to lower their medications much more quickly and easily after that. So I think this is a very general problem that people have with medication withdrawal. The focus has been, for me, like vitamins and minerals and helping the liver and the very general things, along with neurotransmitter support and maybe energy work with receptors. But almost everybody on many different classes of medications, I believe, have underlying needs for healing with hypothalamus, the brain, genetics, and enzymes.
Mm-hmm. I do have a question about that for people listening at home, because it took, even working with you, it took me a while to figure it out. And I know I've told you many times that when I first started working with you, I was not very familiar with energy work, but I understood it enough to know that it couldn't hurt, right? So let's give it a go. Now I'm obviously a full believer in how powerful energy work can be. But what I find what I started to find while I was working with you really interesting, and you discussed it in this case, was how you're able to test levels and really identify exactly like you spoke about being able to test, is it her genes? Is it this? Is it that? And then you were giving numbers like it went from, I forgot what you said, down to 30.
Yeah,
and you're
20%.
and you're doing energy testing to kind of identify all this. So for people who aren't really familiar with how that works, how would you I know I always love the analogies that you use, but how would you kind of explain that, the actual energy testing, aside from the energy work, the energy medicine that you do? I know it kind of all fits together, but.
Yeah. With any kind of medical field, there's a diagnostic process and there's a healing process. So for traditional psychiatry, the diagnostic process is the psych history, and the healing process is their medications for psychiatrists. For functional medicine doctors, the diagnostic process is functional lab work, and the healing process is their vitamins and minerals and glandular supports that support the building blocks of the body and making sure the body can rebuild itself. With energy medicine, the diagnostic process is this energy testing method that I've created and refined. And then the healing process is shifting energy. Okay. And so when it comes to energy, energy is synonymous with information. And so you can imagine if you're familiar with how to manipulate energy, that most clinicians start to work with, how to diagnose using energy as well. And just like the computer and the internet, it's going from, a system where you have to see something in a book and look it up in a textbook to, being able to use the internet and access information very easily through the internet. And it's just a matter of digitally, or like through energy medicine, using something that is more like information based rather than the physical lab work to show what's going on. So when I do energy testing, I'm using scales from usually like 0 to 200, where 0 represents not at all, 100 might define an optimal state of whatever you're testing, and 200 defines an excessive level of whatever it is that you're testing. And what people don't know, if they're not familiar with energy work, is that everybody has this innate ability to have a differential reaction between what's true and false at an energy level. It's not something that you can feel like, like sensationally, like in your body, but it's something that happens all the time. So if you have a very strong ability to test or to have an energy shift between true and false, it shows up in your body physically. Mm-hmm. And so what energy clinicians do is they link that physical change in their energy between what is true and false with a very easy biomechanical feedback mechanism. And those biomechanical feedback mechanisms can be the difference between strong and weak, or a magnetic sensation of moving towards or repelled from. And when you link so let's say you have an energy state in your body that can tell you what is true and false, and you now can manifest it in a biomechanical feedback mechanism, then all you need to do is apply that testing method on something that will then project that information in a readable form. So the scales are then used to test what is true and false along that scale. So you need a couple of pieces of information. You need to identify the patient that you're testing, and you have to identify the time or duration of time that you're testing. And then you create the scale. Let's say if it's digestion, 0 might mean 0 digestion during this period of time for Emily or for me. And then 100, you have to define what optimal digestion means. And then 200 will be excessive digestion. And then as you go along, you're like, is it at least 5? Is it at least 50? Is it at least 100? You can link it to that biomechanical feedback mechanism, and you might get a true with 100, but a false with 95, and another false with 105. So then you record, okay, for me between, over the last 2 weeks, duration with this scale, measuring my digestion, I'm at 100. If I'm at 100, it means that the definition for 100 applies to me during that duration of time. That means I have optimal digestion. But if I get, and you need permission from the patient to test them, but let's say a patient comes and I get a number 20 on that scale, and 25 is false and 15 is false, and I'll record 20. But 100 is their optimum during that period. So if I get 20 on that scale, that means during that period of time, instead of being optimal in terms of digestion, in which case I would get 100 for their value, I got a 20. That means they aren't really digesting well at all. And so something has to intervene. And you can use energy medicine, you can use functional medicine, you can use a combination of the two. So in this particular patient, I had to create a new question. And that new question was, how is her genetics doing? How is her enzymes doing? Then I had to look up all the specific enzymes for every neurotransmitter system that is important that she's been exposed to, and check every enzyme. How is it functioning during that period of time? How is it able to convert, L-tryptophan to 5-HTP, and then from 5-HTP to serotonin, and then from serotonin to melatonin? And then I'm making all these scales from 0 to 200, and then I'm measuring it. So what I got with her genetics was 20%, and her ability to create serotonin from 5-HTP was 20% by the time I created that new question for her. Because I knew something was wrong with her serotonin system. I also knew from testing that it was not amenable to additional 5-HTP. Nowadays, her genes and her enzymes are able to handle 5-HTP. So now she's taking full doses of 5-HTP to help her build serotonin. But there were other issues. It was a big, deep rabbit hole that I went down, because not only did she have problems with serotonin, but like, for example, this past week, we were discovering that she had very high ammonia levels. We had to deal with that. She had foggy thinking. We did energy work. And honestly, she didn't want to take another supplement. She already was on detox foot pads and liver extract and trimethylglycine and all sorts of things to help her with detox. So what we did was we did energy work on helping with the ammonia problem, because there was something that needed help. And after we treated it, I asked her about a week or two later how her foggy thinking was doing. And she just had forgotten that was a problem because it was gone.
I know that feeling. I remember having that as well. Like, oh yeah, that's what we worked on, because it happens so quickly sometimes.
Yeah, exactly. Today, I met with her. Today was one of the 3 days that we were working on her issue. Today we worked on, there were two issues. One was her mornings are particularly hard. And so I did an analysis to check what were the key issues like for the morning. So I checked the duration of 5 hours because we were meeting in her morning time. So I checked a period of 5 hours for her. And it turned out there were two key issues. One was low blood sugar. Her hypoglycemia was between 60 and 70 milligrams per deciliter. And fasting blood sugar should be at about 99. So she had a kind of exaggerated low blood sugar, which can cause stress and anxiety. And it stimulates adrenals to release adrenaline. And it can interfere with sleep, because your blood sugars are falling and your body doesn't want you to keep sleeping if your blood sugar keeps falling. The second thing was toxins. There was something going on with increased toxins in the morning for her. So again, we've done so much with the functional medicine piece. She didn't want to take more supplements. So we did energy work today, bringing additional energy with intention to help her with those two specific problems. Now, we did it along with the lady who can see people's energies, before and after. And also she, heals along with us. And we can tell we're all healing because we're all yawning and tearing up during the energy work. And so all of us were like yawning and tearing up during the energy work. And the person who can read and see the actual energy, before she saw a bunch of, like dark spots in different places, And afterwards, there were no dark spots, and all she saw was golden pink light. And the gold light was stronger. It was brighter. So at least with that energy work, it helped with that energy state. What I'm working on, though, is sustaining it. Like, how do we create an energy intervention that not only brings that energy up to where it needs to be, but helps a person to sustain that energy? That is a little bit tricky, because a lot of times what I notice with energy work is you can raise the energy, but it's almost like recharging a battery, and then you use up the energy, and you might heal a little. Let's say you have this much of a problem, and right after the energy work, you have all that energy and you feel good. But, like 3 days later, your energy is already depleted in the battery. And let's say if this was the baseline in terms of your health, you've improved your health by this much, but not this much, Mm-hmm. So my goal is to intervene with energy healing and try to minimize that kind of effect. So the person can heal and stay healed.
Mm-hmm. Yeah. So that's probably a big reason why you, I'm sure, with all of your patients, because I know you did it with me, is consistently encourage us to do those daily energy breaths, right? Is that almost like tapping back into the battery?
Yeah. And people who do that really save a lot of money in terms of the number of supplements they need. Mm-hmm. And also they can recharge their batteries, on their own. I just feel like 2 heads are better than 1. So sometimes, you have 2 people getting together, doing energy work, and you can shift more energy. Mm-hmm. And that brings up a really important point, which is maybe it's not possible to shift enough energy to sustain it forever. You know what I mean? Mm-hmm. Because it may be that given our brains and how much energy we can shift with our brains, it may be like we can only shift a certain amount of energy when we do it. On the other hand, I'm the eternal optimist. So I'm always, trying to think, well, maybe I could help this patient sustain well-being. One of the things that I've been trying to improve is, as I'm trying to, create bigger and bigger improvements with the energy healing interventions, is I'm starting to get some insights about how to improve my ability to shift energy. And one of them is limiting beliefs. So I had this limiting belief that I can shift energy and the energy can shift easily, but the biology might take longer and be harder to shift, because biology is E equals mc squared. That's my kind of training, that energy equals mass times speed of light squared. So it's a lot of energy for just a little tiny bit of organized matter, right? So that was my limiting belief, that biology will take longer to heal. So I just try to, when I do my energy work now, I just think, who am I to know or limit how much this energy can heal? I'm going to just get out of my own way in the healing process and allow the energy to heal as much as it can. And it did really help magnify the power of the energy work. Let's see. I think that was the biggest thing. The other thing that we did that was helpful for getting rid of healing crises was tapping into the right kind of idea of life energy. So rather than just plain life energy, we wanted to tap into this idea of a loving source of life energy that would create a healing process that was stress-free. So that was another way in which, we try to help it. The other thing that I was trying to do to help energy work do even more powerful work was I realized in the middle of my energy work that there's a difference between using life energy as this kind of almost like a godlike intervention that does the work for you, and we're just little oh, please help, that kind of attitude, to understanding that life energy is a building block of health, just like the supplements are, and that the responsibility rests within us to be that bridge to shift that life energy to that person through our own mental state. Mm-hmm. And so the mental state has to be more responsible for the healing process. It's not like, let's just have this energy flow through, because in all my years of working with energy, it doesn't just randomly do things for you. You have to, guide it through your intentions and whatever it is that we're doing on the energy piece.
Yeah. Sorry, I was just going to say that really resonates with me, because I've always thought of it as being sort of compounding the energy work that I did with you, and then pulled it into my everyday life. I think I've told you this before, without even realizing it, because it was so impactful, and really practicing it and visualizing the types of stuff that we had worked on. And so, yeah, I had always kind of pictured it as being compounding in that way and needing to connect regularly. And yeah.
Mm-hmm. Absolutely. That sense of taking personal responsibility as a bridge, where your intentions, your ability to kind of know that there is this kind of energy that you can shift through your intentions, and directing it in terms of what to do as a responsible, co-creator, I would just say, attitude, I think is another way in which we can enhance how energy works for the patient that we're trying to help.
So it's so interesting. I think the learning with energy work is like unlimited. There's always something to learn, but that does make me think about a question I had about something we were talking about earlier, because you were comparing this patient that you had to work so long to help versus the one who was also dealing with protracted withdrawal that you were able to help in about a week, I think you said. So what do you think is the difference there between why some people don't deal with protracted withdrawal at all, or maybe their healing is much shorter? Others, like we said, it can last for years and years.
Yeah. So the patient who took a lot longer to heal had two key things. Number one was a downregulation. She was no longer able to have the enzymes to create serotonin at the levels that she need. But the other thing was that the way it showed up in her was that her GI system really was deeply affected, meaning that her appetite kind of went away. She couldn't eat very much. And so without the nutrients, maybe even the supplements weren't working properly for her anymore, because the GI system was so deeply affected in her situation. The other patient was on Prozac. Maybe it had a different effect on him, but his GI system was not as deeply affected. So his GI system was able to take the supplements in, and he was still eating pretty well. And so I think when we did the energy work, the nutrients came in, helped rebuild his body, and then he went on. But for the other patient, she wasn't able to eat very well. And so I think you put in the information and the energy to support the body, but if the body doesn't have sufficient building blocks with the food and the nutrients, because the GI system was literally, like not absorbing and digesting and bringing the nutrients to the rest of the body because of her presentation with protracted withdrawal, then it really slows down the ability for the information and the functional medicine to work together. Mm-hmm. And information from energy medicine is a wonderful way to heal the body, but functional medicine really needs to bring the building blocks nutritionally so that the body can actually use that. Like I can't do energy medicine and make an apple appear. Like sure. It's just so much energy that it's difficult. But
so the goal is to heal the issues so that we can take in the supplement, the functional part of it.
And she was on a lot of GI support, but she didn't have the ability to make serotonin. And 95% of our serotonin is in the gut. And so the real intervention was the energy work. We worked really hard on making sure that the genes and enzymes were there. And then we kept testing, can she take more 5-HTP to start making serotonin? And as the serotonin systems start getting better, then her body can start, using nutrients better. So it was really within the past, I would say 1 month, maybe last 3 weeks, that she crossed certain milestones in her recovery where she said she was hungry, that she's eating better, that kind of stuff. That's a really good sign that she's taking in enough nutrients to then use the energy medicine techniques to help her heal faster.
Mm-hmm. Yeah, that must be such a good feeling for her too, just knowing that your body can't tolerate these things. That's something I see in those groups a lot as I'm continuing to do research for the documentary, is the people in protracted withdrawal. So many of them do talk about the fact that they cannot tolerate supplements. And I've always kind of wondered why that is, but that's a great explanation as to why. That it's because you essentially, I think if I'm following correctly, you're saying that it's a lot of those underlying symptoms, right, that tend to not get addressed, possibly get worse because of the medications as you're going through the withdrawals. What other kind of layers are there with that?
Yeah, for this particular patient, it's not that she wasn't able to tolerate supplements. It was like she wasn't able to use them properly. But the ones who can't tolerate supplements, the only thing that I know of that can really interfere with tolerating supplements is if over the course of the recovery, a person has developed really severe leaky gut syndrome and had created and during that period of time took a lot of supplements, and the supplements had leaked through the leaky gut, and now the body is hypersensitized to certain nutrients. So I have seen that in certain patients. Like I have one particular patient who had a period of, severe restriction and also severe binge eating. So her GI system wasn't functioning, obviously, for her to have those struggles. But when I did the initial checking with the energy testing, she had a lot of nutritional hypersensitivity reactions. That means her immune system sees a lot of nutrients, whether it's minerals or vitamins, as foreign substances now, and is creating an inflammatory reaction to those nutrients. So for her, she has had so many different, holistic and functional doctors trying to help her. She herself is a clinician who has worked on so much of her own psychological well-being, but she has never been able to come off her multiple medications. Like, it's just been really hard. And so she asked me to do the energy testing to figure out what are the underlying causes. And one of the big ones is that her body has developed an immune reaction to things that her body needs, like vitamins and minerals. And you'll have to use energy work to fix that.
That's what I was about to say, to even test for it, I think, right? Because that's, as you've gone through and described these different cases and just how it all works, how else would you figure out how to solve it? Even if you were trying just the functional side, it would be, it feels like endless trial and error, right?
Yeah, you wouldn't even be able to get the data to know then what to do. And even if you got the data through some miraculous functional lab result, you wouldn't be able to fix it with a supplement or a food item or a glandular, So it's something that can be done much more quickly with energy medicine interventions.
Right.
I think we've covered just about the main things that I've discovered with protracted withdrawal. These are things that I think, in summary, were not able to be addressed, despite the fact that I was doing energy work on the patient's, traumas and cell receptors and building neurotransmitters, helping them with their hormones, helping them with cortisol levels, helping their GI function with, decreasing candida. All of these things are routine that I provide for my patients. And despite all of that, they still have protracted withdrawal. So there is a particular group of patients whose underlying causes, once you kind of figure out what those underlying causes, they need to be treated at the beginning of treatment, helping them with energy medicine, helping them heal those areas. So by the time they are ready to come off their medications, all the other things that are chronic can have most of it be healed by the end.
So in my understanding, you're saying have it healed before you start coming off the medication?
Well, what I mean is they all have to kind of coincide. Like if you want to come off the Lexapro, it's not just about building neurotransmitters that are serotonin neurotransmitters. It's also about making sure that by the time you get off the Lexapro, all of these underlying causes, all of the harm by the medication, everything's been treated. So by the time you come off the Lexapro, what you have is an experience of health rather than an unmasking of underlying causes, which can still require quite a bit of time to heal. And sometimes, if these problems are, let's say, problems with the GI system, that can cause ripple effects that undermine your health. And they're not something that you want to continue for a year or 2 years because your health will deteriorate, not improve. So now for this particular patient who required a lot of energy work, she is still on 3 milligrams of Lexapro because we had to buy her some time with that. And maybe what we can end up with our discussion is some of the psychological traumas of coming off medications. Because she herself had tried with some other doctors to come off Lexapro in the past, and she got extremely ill. And she got back on the Lexapro and took her several months to get back to her health. In this situation, she did also experience withdrawal. I would say for about a month, she was very uncomfortable. And so I would say that for her, because now she's had 2 experiences where, she's had a difficult withdrawal, it's going to be very hard for her to want to come off of Lexapro completely. But the thing is, as long as she's on Lexapro, it's going to do what Lexapro does. And a lot of the SSRIs deplete the storage levels of serotonin. It can, decrease, genetics and enzymes still. So at some point, hopefully, we can heal her trauma from the withdrawal and then hopefully get her off that 3 milligrams. But I don't expect her to be able to do that until she's been well and robustly well for quite a while.
Yeah. I was actually going to mention that just because that's ultimately, I didn't go through the same situation, but why I came back to you a second time.
Tell us about that.
Because I got off all of the medications and I felt great. And there were times you were doing the energy testing, and I remember because I was living with my parents at the time, I wasn't able to function on my own. And I remember telling my mom, Dr. Lee is crazy. We're doing this. But she did the energy test. And my mom would say, well, it hasn't gone wrong yet. And it was fine. So I got off the medications and I felt great for a little while. And we did address a lot of things, like you explained, kind of underlying health issues. But what we I won't say never, but we didn't, I think, fully address at that point in time the psychological kind of impacts of having been through the side effects of the medication, not understanding what was going on, spending years being ill, not understanding what's going on, all this different stuff. And so I think it was like 6 to 9 months I was doing pretty well, and then just a very rapid decline, and I reached back out to you. And that's when we started digging deep into the psychological stuff and using energy medicine for that as well. And we uncovered a lot. But I think that's what made the biggest, obviously not the biggest difference, but it was the final piece of the puzzle, I think, that really, really needed to be done. So there's so many aspects to healing.
Right.
It's not just the medicine and getting off the medicine. There's so many aspects.
The first time I just felt like, you asked me to help you get off the psychiatric medications, and I helped you as much as I can. But there was a piece of it that I really didn't feel responsible, or I didn't feel like I should be responsible for because I didn't have enough information or expertise on. And that was your hormonal aspects.
And endometriosis.
Yes. And so you went to a separate functional doctor for that. And when you came back, I guess we did decide that we'll try to do what we can to help you with that as well. So with some energy work and with what you were able to discover, we fixed that.
And I think, and that's a big part of what I mean was just chronic illness, because I've been dealing with that since I was like 12, 13. And we really were able to connect the dots for the psychological aspects of having endometriosis my whole life, and what that did to me. It wasn't something that even crossed my mind while I'm just desperate to get off medications, right? But it does. There's just, I think we both said, it's like an onion. You just keep peeling back layers. So.
And remember just even the difference between silversilin spray versus silversilin liquid.
Yes.
There was still probably some viral component that needed a little bit more tweaking.
Yeah, because I had been sick off and on for several months with different viruses, flus, stuff like that. Yeah. And then,
And remember you said, oh, why are we using... Yeah.
Already using the spray. It's going to be the difference between the other one. And then that next session, I think I told you, I don't know what it was, but it was like the next day or 2 days later, but I felt completely back to myself because it was just like 3 months just being hit with viruses back to back to back. And I just felt like I couldn't get better. My throat hurt. Yeah.
So energy testing is the key to, figuring out all these puzzles for patients. And then we have to do research and figure out, if this is what's going on, how do we help with this enzyme? And sometimes you don't know how to help with the enzyme. So you just say, let's get that life energy in there and have it help support that healing process. And that's where it's been really helpful to not have to know every supplement under the sun in order for people to heal. So I think we should finish up with our podcast and maybe just make a quick summary that sometimes with protracted withdrawal, we're just trying to finish up chronic underlying causes that's been going on for a long time. Things that can't be fixed with a supplement in functional medicine has to be addressed with energy medicine. And that sometimes, there's a suspicion that almost everybody may benefit from using energy medicine techniques earlier on in their withdrawal process to help them with the withdrawal, not just with SSRI withdrawal, but with other supplements, with other medications as well. So thanks, Emily, for participating in our podcast. I really enjoyed working together today.
I did too.
And thank you for your insights and input and questions. So for those of you who have stuck with us through the podcast, I want to thank you for listening. Emily and I will be getting together twice a month to create a couple of podcasts every month. And we'll be picking different topics that are relevant each time for a holistic understanding of psychiatry. So really excited to have her join me for these podcasts. And I really hope that you will join us next time it comes out. So for those of you who have subscribed to this podcast, and if you like this information and found it helpful, please give it a positive rating. I hope you'll subscribe to my newsletter on my website where I write articles that can be very helpful as well and can send it to you. In addition, I want to announce that I have started a Substack content called Holistic Psychiatrist, Alice W. Lee, MD. And I'm excited about that. It's a space for my opinions and reflections on cultural, political, social, and psychological issues. So it's a little bit different from some of these podcasts on holistic psychiatry. And I hope you'll subscribe there as well if you wish to see what I write in terms of other issues. And finally, if you want to integrate high quality nutritional supplements, there's a area on my website called products, and you can sign up for FullScript and FullScript can provide a lot of high quality supplements, and it's very easy to order from there. So I look forward to sharing more insights, Emily and I, through these podcasts, and I look forward to writing more articles for you, and I hope you'll thrive as you build your life from the thought up. Thank you for listening. Bye-bye.
The content provided by this podcast is for informational purposes only and has not been approved by the US FDA. This podcast is not intended to provide personal medical advice, which should be obtained from a medical professional.